Hey everybody, Dr. Wuzzardo here. It is Glaucoma Awareness Month, so Happy New Year to everybody. Glaucoma is a very important topic. It actually is called the silent thief of sight because in most people's cases, you don't know it's occurring. What glaucoma is the pressure in the eye is elevated enough that it starts to damage the optic nerve. The optic nerve is the messenger system from your eye to your brain. So if that messenger system gets harmed by the pressure being a little elevated or too high, that message won't get back to the brain like it should, and your brain will then not be able to form the image that it should to help you see, which is why it results in visual loss. Normally, a gradual decline in the vision, a progressive damage of the optic nerve. Sometimes, depending on the person or type of glaucoma, it could be quicker than others. So there's several types. Some you feel, most you will not, which is why it's important to get your annual eye checkup. And sometimes if we see some risk factors, we will ask you to come back sooner than yearly to make sure we're checking on that pressure. Some risk factors include age, family history, IOP or intraocular pressure, and where that is. Normal IOP would be 10 to 20, but that's different for everybody. Sometimes it's in a normal range and it's too high for that person to handle, and sometimes it's over 20 and it's okay. But over 20 usually gives us the tip off to say, we need to watch this a little bit closer. Optic nerve shape and size could be a risk factor. And we kind of put all these pieces of the puzzle together, and there's some testing here at the office that we can do to give us some more pieces and really just see, in the total package, what is going on with that optic nerve and if it's healthy or not. If we find that the optic nerve isn't healthy, usually it's treated with drops. So you would take a drop, normally just one in each eye, usually at bedtime. Sometimes we have to change those drops or the drop regimen. You may have to take it at different times of the day. But most people are controlled well with one drop, and we watch you a little more frequently if we have to start that treatment regimen. But it's something that we always look for. So each time you're in, we'll always keep an eye out for that. And if we need to follow up or do extra testing, then we'll do that in order to keep your optic nerve healthy and your eyesight as good as possible. Have a good January, everybody, and we look forward to seeing you in the office soon. And take care. Again, Happy New Year.